pregnancy bleeding in women on a hormone replacement therapy cycle in a frozen replacement. So what they look at? They looked at a systemic meta-analysis and a systemic review. They also looked at secondary data from their own cases, and they found that the risk of having bleeding in early pregnancy in these cases was about 47%. Remember, these are hormone replacement therapy cycles. Now, the systemic review, in fact, said that the incidence may vary from between 6% to 70%, and that's a wide variation. In this study, when they looked at their own data, it was suggested that out of 171 patients, whether patients had some bleeding or not, and if they had little bleeding in early pregnancy and then it stopped, or in the other 106 patients, if bleeding did continue in a small amount, there was no difference in live birth rates. And that's very reassuring. That's reassuring because it seems that the chances of pregnancy seem to be very similar to those who have a bleeding and not have a bleeding. Now, when we looked at the systematic review, it seemed that the systematic review did say that the chances of miscarriage or early pregnancy loss were more in women who had bled. But here again, they did include heavy bleeding, which could be a negative factor. Now, there is also some evidence from this study suggested that in 2010 that there was a greater risk of postpartum hemorrhage and HRT cycles in women who started bleeding compared to a modified natural cycles. And in women who had some bleeding, or rather some low progesterone on the day of embryo transfer, seem to have a higher risk of bleeding in early pregnancy. And again, these are very much smaller studies, but what this gives us a summary is that the chances of pregnancy are very good, even if there is a small amount of bleeding that occurs in early pregnancy in a HRT frozen